Zampula and welcome to Dungtsho BBS. I am Sonam Chiki, your host. Food is one of the most basic needs of human, and the only way to eat food is through our mouth, chewing and savoring them slowly with the help of our teeth. The question being, are we giving enough attention or the required appreciation for the most hardworking organ in our body? Yes, I'm still talking about teeth. To further clarify our doubts and to get more information on oral health and hygiene, we have Dr. Tenzin, a dental surgeon. Thank you so much, doctor, for coming on our show.
Thank you. I would like to begin by commending BBS for its show Dungtsho BBS, which has been running successfully for years. And in these years and in these times, this show has managed to indulge and bring people's attention towards their own health and concern towards their health, and that too at a very large scale. So I would like to congratulate BBS, Dungtsho BBS, and the whole team for it. Thank you so much. And to introduce myself, my name is Dr. Tenzin, and I'm a dental surgeon in Paro District Hospital, and I'm extremely privileged to be invited and to be a part of your show. Thank you so much.
Yes, thank you, doctor. How much do we really know about our teeth? To find out, we went around and we asked people a very simple question about their teeth. And we have made a video on this. So let's take a look. 29.
32.
30. I think 28. 29.
Doctor, looking at this video, it seems that different number of people, they have different number of teeth. And somehow they seem to be okay with it. So what do you have to say on this?
Okay. Thank you so much for this initiative, for this survey video. This video will help me and all the viewers draw a baseline on the general knowledge of people, how much they know about their teeth, right? So most of the people watching this show right now must be expecting me to say something about oral cancer or some sophisticated surgery or some sophisticated disease related to the mouth. But I would like to stress on the basics. Today, I would like to speak basics, something that everyone should know about their teeth and the mouth, but most of the people don't. And coming to your question about the number of teeth. Okay. So we are born till we perish. We are born with two sets of teeth, starting from the 6th month to the till the child reaches 2 years old. We have the first set of teeth called the primary teeth, or locally known as the milk teeth. And as soon as the child becomes 6 years old, that's when the tooth starts shedding and it starts changing, and then by the age of 18 you're expected to have 32 teeth. But with evolution, which is coming in place, the type of food that we're eating, our body is modifying. So now it's safe to say, or it's nothing to worry if you have 28 teeth, because we are slowly losing all our wisdom teeth. And there is a lot of, I could say, about the number of teeth, but let's stress about how actually a tooth looks like. By the number of cases that I have, or the clients that I have tended to in all these years, I have deduced to this conclusion, or deduced to this understanding, that people take tooth as a solid structure just meant for chewing. But that's not the case. So with the kind permission of one of my friends, he has given me the permission to use one of his YouTube videos. His YouTube channel is 3D. So he has given me the permission to use one of his 3D videos to show the people and all the viewers of how exactly a tooth looks like in the mouth. So with your permission, I would like to play that video.
Yes, definitely, doctor. Please go ahead.
There is much more to a tooth than just the part you can see in a smile. That's because our gums hide everything except the top of the tooth. an area called the crown. Because this part of the tooth grinds up food, it's covered with the hardest material in the body. The thin layer of tooth enamel is the reason our teeth are hard, white, and shiny. Underneath the enamel and down into the roots, the tooth is made up of pale yellow cementum. Although it is slightly softer than the enamel, it is still harder than the bone. The middle of every tooth is hollow to make room for blood vessels needed to keep the tooth alive. This collection of soft tissue is called the pulp and also contains the nerves, which warns us when something is wrong with the tooth. Every tooth sits in the socket in the jawbone. Above the jawbone, the tooth is wrapped in a firm cuff of gum tissue, or gingiva as it's sometimes called. The gum attaches to the neck of the tooth where the enamel finishes, hiding the complex structure below. And that's why there is so much more to a tooth than meets the eye.
For a small organ such as a tooth to have such a detailed anatomy is simply mind-blowing. We have asked some more questions, and this is what they have to say.
Twice, but sometimes only once.
First, I only brush once a day, but once I got tooth pain, I started to brush the teeth twice a day.
Twice, morning and evening.
Yes, sir. I think they are not brushing time.
So legendary.
People, they don't brush on time.
Maybe they are eating lots of fast food.
Doma hema doma savila.
Tomagi problem the mostly in the and throat cancer, the mouth cancer digital message.
Ani color change pa.
Doma kasni ganda tobacco ka change
Like I mentioned before, thank you so much for the survey video. It makes everything easier, especially for people to understand. Now, the question that you asked to these people is, the second question is, how many times do you brush in a day, right? So I remember when I was in school, or for a long time, we were told to brush 2 times a day. And most of the people now, they do know they have to brush 2 times a day, one in the morning and one before you go to sleep. But I feel it is important to know the amount of or the times you brush in a day, but the most important thing is actually how you are supposed to brush. No matter if you brush 3, 4, 5 times a day, but if you don't know how to properly brush, then it does not match, it does not live up to the proper cleaning or proper oral hygiene. So I think it's important for us to know how to brush and then stress on how many times you brush in a day. So I would like to take this opportunity and this tooth model to show the viewers about how actually you're supposed to brush. So before we begin, I would like to stress on the toothbrush, the toothpaste, and then the techniques of brushing.
Yes, okay.
So when it comes to toothbrush, there are so many types of toothbrushes, but regardless of the company, I would like to stress more on the bristles. Most of the people that I've seen, they buy hard bristles. That's because they're not proud of their stained teeth, especially after having the habit of eating doma. So the only reason they buy hard bristle toothbrush is to get rid of the stains. But in that case, it slowly erodes away the tooth and even affects the gums. So I would like to ask all my viewers and all the people, when you buy a toothbrush, make sure the bristles are either medium or soft. So if you have a hard toothbrush, I guess it's time you change your toothbrush. And now when it comes to the toothpaste, this is a very common question that people ask me, which is the best toothpaste that one should use. So I don't have a particular answer for that one or a specific brand that I would suggest people to use. But all I could say is they should use a toothpaste which has fluoride content in it. Fluoride is an agent, it's an antibacterial agent, so it lowers the bacterial flora in the mouth. So now we know about the toothbrush, about the toothpaste, now about brushing techniques. So before I begin my brushing technique, I would like to show the surfaces of the tooth. So let's say the outer surface which faces the face, we'll call it the facial surface. The inner surface and the surface where the tooth meets is called the biting surfaces. Or most of the clients that I have, I've noticed that the inner and the posterior regions are ignored, and once you start ignoring, there is a calculus buildup, and that leads to a lot of bacteria and tooth problems. So now when we start brushing, the toothbrush should be angled in such a way that it slightly leans on the tooth and even involves the gums. So while you brush like that, we are even massaging the gums. So when you massage, there will be a lot of blood flow to the gums, which actually makes the gums healthier. Okay. So the toothbrush, we lean the toothbrush towards the tooth and the gums, and we give a small circular motion, and then we just sweep it out so that even the spaces between the teeth are being cleaned. And that's how we follow through. And then not forgetting the inside portion. We give the similar portions inside, and the front portion, which most people leave out as horizontal strokes. So most of the time people are used to just horizontal strokes of brushing. So I would suggest the only horizontal brushing technique to be used on the tooth surfaces, the biting surfaces, because these biting surfaces, when you use the horizontal technique, it does not involve the gum, so you can use the horizontal technique. And especially the posterior region, if you think it's not properly clean, I suggest my patients to keep their teeth together or close their mouth and then try to clean the posterior region. So since the muscles are not flexed, the toothbrush goes all the way behind and then it's properly clean. And we can further, after brushing the teeth, we can further use dental flosses to clean the areas between the teeth, and then we can even follow it up by using mouthwashes. And when it comes to toothbrush, I would suggest that as soon as you feel that the tooth bristles are flaring, that's the time when you change your toothbrush.
Even I brushed twice a day, but I did not know the proper way of brushing. So this demonstration was really, really helpful.
Next question that you asked in your survey is about toothache and why we actually get toothache. I'm pretty sure almost everyone has suffered toothache, and I say that very confidently because the general population of our country, they visit the hospital or the dental clinic only when they have pain. They are reminded of the hospital only when they are in pain. And it's because the bacteria or the tooth decay has reached a certain extent that it has reached the nerves that I had previously shown you in the video. So a pain is excited. So if I give you a basic idea about how a tooth decay starts and when we should intervene. So food, while we eat, it's been chewed on the tooth, right? So basically bacteria, we have bacteria in our mouth all the time. Our saliva contains bacteria all the time. But when exposed to food or sugar or carbohydrates for a long time, these bacteria gets excited or converted into, we can say, bad bacteria, right? So these bad bacteria acts on the food which is left behind because we are not properly taking care of it. So with time, these bacteria eat on the food and then slowly releases acid. So actually it's the acid that eats away or corrodes the tissues of the tooth. So it slowly eats away the tooth. So at initial, so now if you brush properly, right, if you give a little attention and see what you're brushing, if you see a small black spot, that's the initial decay or dental caries. So that's when you actually visit the dentist and then get it treated, because at the initial stage it's a conservative. All you have to do, all I have to do, or any dentist has to do, is just to clean the decayed part and then restore it by a filling material. But then you tend to ignore that. You would say it's okay, and you continue doing what you normally do. You eat, no proper oral hygiene, and then the decay goes further inside the tooth. So it further goes towards the nerves. So that's when the decay actually touches the nerves. It's at the state where the nerve is telling your brain, saying that something is wrong. And then because of the infection, the nerve starts rotting, and that's when you get a lot of pain. And that's when most of the patients comes to a dentist. And in that case, you're not giving much of a choice to your dentist to save your tooth or give a conservative treatment. So then we might have to do treatment which might involve injection, which might involve a little bit of pain, or it might involve even to the extent of extraction. But people sometimes, even after pain, they try to bear the pain and then lead to further decay, which might affect even the bones. So my answer to your question is, toothache is initiated by bacteria, and bacteria is initiated by poor oral hygiene. So I hope I answered the question.
It's very true the way you said that people visit hospital only when they are in extreme pain. And by the time they reach the hospital, enough damage has been done, and there's nothing to do to save the tooth.
To answer the last question, this is one of the nightmares of all dentists, especially in Bhutan or northern India. It's because of doma. People's concept or their approach or their understanding to doma is exactly opposite to what we understand. And I've been trying my best to convince people and trying to educate them, those who want to learn or those who are actually concerned. They try to stop or try to reduce. So talking about doma, first thing first, doma, what happens is, as I have already shown in the video of the tooth anatomy, the tooth, 60% of the tooth is the roots, which are inside, and it's protected or covered by the gums or the other tissue structures. So when we talk about tooth, it's not only the mouth tooth, we are talking about the entire mouth. So what happens with doma is, first thing, the acid that chewing doma releases, the stains. Our tooth surfaces are supposed to be very smooth, right? So with the stains of doma, it makes it a little irregular, easier for the bacteria to colonize on the tooth, right? And what happens is, with the stains and with improper brushing, let's not talk about the smell of doma, right? But anyways, so the stains and the deposits, it rests upon the gum lines. And what happens is, with the course of time, the bacterial colony infects all the gums, right? So it makes the gums weak. So it's supposed to protect the roots, but instead, slowly it starts to recede. Yeah, it starts to recede, and then what happens is, then slowly you'll start to get sensitivity. You'll start to get your tooth will start shaking, and at an extent that you might even lose your teeth. And that's about the teeth. And if you talk about the other structures in the mouth, right? The soft tissue inside the cheeks, from the inside, doma, what happens is it keratinizes, or it loses the flexibility of the cheeks inside. So at one point, you might not be able to open your mouth properly or trying to speak properly. You might not be able to be very clear with your pronunciations, and worse come worse, it might lead to oral cancer. And we have a lot of preventive methods. People who want to stop, we have procedures called ultrasonic scaling, we have procedures called prophylaxis, we have a lot of treatments to help prevent, but to an extent that we can only prevent these diseases, these conditions, but we cannot convince the patients on how to stop, because it's up to the patients. It's up to the patients if they want to or not. And the cleaning procedure, people have misconception. It's called a medical myth, and I would like to take this chance again to bring light to the misconception of what they have about cleaning. So people say cleaning leads to more sensitivity, cleaning leads to mobility of the tooth. By that I mean the tooth starts shaking.
Okay.
I think this is not correct. The tooth structure or the supporting structures have been already destroyed by doma. So what we're trying to do is we're trying to relieve all these stains or the factors which are leading to all this. So by cleaning, what happens is we are giving chance for the tissues or the gums to revive. So after cleaning, yes, there is sensitivity, there is a little mobility, but these are all post-scaling, slight post-scaling sensitivity, post-scaling mobility, which given time will heal, and then you'll have a better oral hygiene status.
I really liked the way Doctor explained about the ill effects of chewing doma, because personally I have met a lot of people and then they have a lot of misconceptions about doma. But now I know that it's not true. Nowadays, everyone has an easy access to social media, and it serves as a platform for them to express their opinions or to ask questions. And through one of the social media, we have received few questions, 2 to be precise. I have had RCT done long time back. Lately, it's starting to give me pain. Any advice?
Okay. To those who are watching this show, RCT is called a root canal treatment. So root canal treatment is done when a patient comes to us, like I said, normally, when they have pain, and that's when the infection has reached the nerves. So the only way to save the tooth, if it's a tooth which is worth saving, is by doing a root canal treatment, when we clean up all the canals, all the sensitive part, and then restore it, so that the tooth at least serves as a structure which will help giving the shape of a face or helping in eating, right? So this patient has had a treatment done few years ago, I think quite a long time ago, right? So yes, the success rate for any treatment is, I can say, it's not 100%. And this patient might have had a very successful treatment done, but with the course of time, if the proper oral hygiene is not maintained, the same thing can relapse, or sometimes there can be some defaults in the treatment, and it can turn into improper treatment, but it does not mean it's a failure. So I would suggest this person who asks this question to take time, visit the dentist. If she has, she should take the record of the treatment she had done before, and then we have the technology, we have the medical personnel to help her and to most likely rectify her problems. So she has nothing to worry about.
That's okay, thank you. Second one says, I have a tooth with a large cavity for quite a long time and it does not hurt. Am I to be concerned?
This person has a large cavity for a long time and it does not hurt, right? This is a common case. There are a lot of patients who slowly realize that they have a large cavity, and that's shocking. But yes, with the course of time, maybe the pain factor has even gone away, right? So it's not giving her any pain. But our tooth is supposed to be a complete structure. The function of a tooth is to properly give a shape to your face, help you to speak, and most of all, help you to eat. But if you have a cavity, that also a large cavity, It's not helping you to eat, but it's serving as a purpose of infection or pain in the future, because all the food that you eat goes in the cavity. It's almost like a pot in the mouth, right? Like a vessel in the mouth. So all the infection, all the foods are going inside, and you cannot guarantee that you can clean it thoroughly. So with the course of time, there will be slow development of infection. And if not properly taken care, it might lead to more infection of the bone or infection of the skin inside the mouth. So now, since this patient has realized that she has a large cavity, I would suggest her to visit the dentist again, and then get it treated. Either the tooth can be treated and saved and given it a proper structure, or else in this case it might lead to extraction, which is preventing from further infection or further complication. So that's it.
Yes, okay. Thank you, doctor. Everything that you explained was very simple, it was educative, and it was direct. Now that you have gotten the viewers' attention, is there anything that you want to add or any advice?
Okay. I would like to say, first of all, while brushing, be gentle, be thorough, and when it comes to tooth decay or doma or anything, I would suggest people to love themselves, love their tooth. It's doing something for you, so do something in return, right? And other than that, I would like to tell all my viewers that even if you have no problem with the teeth, even if you find no decay in your teeth, it's wise to at least visit a dentist once in 6 months, or if that's too much, at least once a year, just to see, so that anything at an initial stage, if we try to prevent it, so it will be a conservative treatment for all the patients. And I would like to conclude by saying or quoting a very famous person, Shakespeare. He said something like, love can conquer everything except for poverty and toothache. So I guess take heed to what he has to say.
I'm sure that you must have learned quite a lot from today's interview. It is the simple and the basic efforts, such as brushing your teeth the right way as shown by our doctor, or knowing your basic oral health and hygiene. I would like to thank doctor for coming all the way from Paro to here.
Pleasure's all mine.
On the behalf of BBS and the entire team of Dungtsho BBS, we really appreciate your effort. Thank you so much. This brings an end to the studio segment. Now we have tips of the week.
When you buy a toothbrush, make sure the bristles are either medium or soft. The toothpaste which has fluoride content in it. I would suggest that as soon as you feel that the tooth bristles are flaring, that's the time when you change your toothbrush. Even use dental flosses to clean the areas between the teeth, and then we can even follow it up by using mouthwashes. It's wise to at least visit a dentist once in 6 months, or if that's too much, at least once a year,